Right, nice and calm.
Prior to the procedure, the patient is given a light sedative called Xanax to make her relax during the procedure. Okay. I'm going to put a little drop in your eye. Then topical drops are used as an anesthetic.
Are we ready? Because I'm excited.
The patient is then placed underneath the laser. I want to use that. And look down. Topical drops are used again for more anesthesia. A lid speculum is used to separate the upper and lower eyelids. To make the flap, a plastic ring is placed over the eye and centered well over the cornea. Accurate placement of this plastic ring is critical so that the flap is centered. After the ring is placed over the eye, the patient is moved underneath the intralase laser. Once the cone is applied to the cornea and adequately and safely docked,
Looks good. 8.5.
the laser is then used to create the flap. The right eye is done first, and then we do the left eye. After the flap is created with the intralase, the flap can then be lifted to correct the vision with the excimer laser.
It's going to blur now if I lift the flap.
The cornea is first marked with a ring, which is dipped into a dye. The flap is created at a predetermined depth of about 110 microns. The flap is then lifted and retracted back onto a sponge to protect the cornea. A second sponge is placed on top of the flap to protect the underside of the flap from the laser. The excimer laser is then centered, the trackers are turned on, and the patient is asked to look directly into the laser. The patient is looking at a red flickering light, which is inside of a white circle. This is another way of ensuring that the laser is centered.
Peggy,
Yes,
look at the red flickering light. You see it?
yes.
The excimer laser is then fired to reshape the cornea. This takes approximately 20 to 30 seconds.
Hold it. Right there. Perfect. Doing great.
The flap is repositioned and rinsed with a saline-like solution. The eye is rinsed to remove any particulate matter or debris that can occur underneath the flap, and this allows for better healing of the flap. The flap is then smoothed out with the spatula to make sure that it is in the right position. I then dry the little gutter around the flap with a special type of sponge, and this allows for the flap to seal relatively quickly.
How you feel?
Good.
Did it hurt at all?
No.
Once the flap is repositioned, we wait 2 minutes for the flap to seal. At that time, then the speculum is removed and the other eye can be lasered. At the conclusion of the procedure, the patient is given a topical antibiotic eye drop as well as a non-steroidal, which reduces any discomfort. Following the procedure, the patient is brought into an examining room where the eyes are examined to ensure that the flaps are in the correct position and the patient doesn't have any problems with excessive debris underneath the flap. The patient is then shielded with clear shields. Love what I
Right.
do because
Right.
all the little details involved and you have perfect. And instructions are given
Okay.
and the patient is sent home. The patient will then return in 1 day for follow-up.
She wakes up, you're going to start your drops.
Okay,
And you'll be using the Pred Forte every 2 hours and then
Okay.
the Vigamox every 4.
okay. I saw
So
that.
they both go in like when you wake up and then 2 hours later